again, my name is Angela Flam, and I think you all know me. I think I've spoken with a lot of you within a lot of the network directors and program directors and so forth. And from those of you who I have not met that you've joined in from the member healthcare organizations, we'd like to welcome you all to our webinar. I am a senior program coordinator with Rural Health Innovations. I have been working in rural workforce and recruitment activities for close to 20 years now, so I have lots of experience in the rural world of workforce and recruitment, retention activities. I am a member of the 3RNet organization, the Rural Recruitment and Retention Network. It's a national private nonprofit organization. Some of you may be familiar with them. And so I hope that between my knowledge and Cap's knowledge that we're going to be able to provide you with a lot of really good information on rural recruitment. So as I mentioned, I have Cap Wilkes with me. She's going to be partnering with me on this webinar today. So do you want to say hello, Cap?
I sure would. Thanks, Angie. And hello, everybody, and welcome to our webinar today. I really am glad to be here. I'll be adding to the presentation a little bit later on when it comes to some of the action planning work. So you'll hear my voice come back later on in this webinar today. Thank you. That's it. Back to you, Angie.
Thanks, Cap. So yes, Cap and I are both really happy to be here with you today to talk through the recruitment and retention plan deliverable that you all have. That deliverable is going to be due December 5th. You may also remember reading about this deliverable and it being referred to as an employment hiring plan. That is the same thing. We are going to be referring to it throughout this webinar as the recruitment and retention plan deliverable. So recruitment and retention plan is the employment hiring plan. Before we get started today, too, I also wanted to share with you that a lot of the content for this Recruitment and Retention Plan Toolkit has been adapted by the National Rural Health Resource Center, Rural Health Innovations, the Midwest Retention Toolkit, and the National Rural Recruitment and Retention Network, or the 3RNet, and their Recruiting for Retention Manual. And all of those resources will be available to you in the guide. I did not share with you also that in the file share on the bottom left-hand side of your screen are all the documents that I emailed to you all about an hour ago. So it's the entire toolkit. So there are 4 documents in the toolkit, and then also a PDF of the PowerPoint. And the PowerPoint will also be available along with the toolkit and the recording on the RHI Allied Health page website either later today or by the end of tomorrow. So just another few words about RHI. I think most of you know who we are. We are Rural Health Innovations, and we're a subsidiary of the National Rural Health Resource Center, and we are very happy to be serving you all as your network TA provider. So the objectives for today's webinar are going to be common recruitment and retention plan questions. We're going to talk about recruitment and the Recruitment and Retention Plan Deliverable, or AKA the Employment Hiring Plan. We're going to go through the Recruitment and Retention Plan Toolkit, as well as have Q&A. Again, at any time during the presentation, feel free to unmute yourself and ask a question or plant it in the chat box, and we'll be sure to monitor that. So, what are some common recruitment and retention plan questions? One of them is, what is a recruitment and retention plan? Another might be, why is writing a recruitment and retention plan worth the effort? And why do we recruit with retention in mind? And then also, who should all be involved in this whole recruitment and retention process? So let's look at them individually. So what is a recruitment and retention plan? A recruitment and retention plan is simply an organized work plan consisting of critical activities or steps to ensure timely placement and lasting retention of quality healthcare professionals. And why is it worth writing a recruitment and retention plan? Well, recruiting and retaining healthcare professionals can be particularly profound in rural areas, where in rural areas when the loss of a single healthcare professional can really impact the healthcare delivery in a community. And so therefore it's really essential that you have a comprehensive recruitment plan in place. It also helps to ensure you've done all the necessary planning and preparation, as well as that you're successful in planning and preparation and your follow-up and follow-through. And we'll talk a little bit more as we get into the presentation about what is the planning and preparation stage of a recruitment and retention plan and what's the follow-up and follow-through stage. But we do know that the planning and the follow-up together will equal better long-lasting retention in your communities. And so why do we recruit with retention in mind? And so differentiating between recruiting activities and retention activities can be difficult since successful hiring and retention of employees is very intertwined. And so if you think about it as recruiting being an episodic effort, and so it includes activities in understanding the workforce need within your organization, identifying key attributes of the needed position and person or persons, and also working to find potential employees that both fit the need of your facility and your community and also match the key attributes. And then whereas retention is, it requires more of an investment with long-term views, and those activities are focused on how an employee relates to work and the people in the organization, such as recruitment and retention team activities, their employee or staff satisfaction, performance reviews, mentoring opportunities, all of those things that go into that kind of follow-up and follow-through. And once you get the healthcare provider working in your organization, what types of activities are you going to do to make sure that you can get them to stay? And then who should be involved in this process? We'll talk about building a recruitment and retention team a little bit further into the presentation, but your recruitment and retention teams are going to or should be consisting of the network project director or project director, your member healthcare facilities, as well as community members. And like I said, we'll get into this a little bit more later, but each person's on this team are going to play different individual roles, and each role is going to be really important to a recruitment and retention process. So it really takes a village to recruit healthcare providers and to keep them in your community. And so recruitment and retention, the toolkit that we've created, RHI is supporting your deliverable by providing a recruitment and retention plan toolkit. And this toolkit, as I referred to before, has 4 sections. There is a guide which has the components of, all the components of an effective recruitment and retention plan. There's an assessment tool, and what that is going to be is a tool, or it's an assessment that the healthcare organizations, your member healthcare organizations, are going to complete to assess where they're at in their own individual recruitment and retention plans. And then there is an action plan that the network directors or project directors are going to use to summarize all of the feedback from your member organizations on where they are in their recruitment and retention plans. And then that assessment is going to, those assessments are going to help you identify any gaps that you may have in your recruitment and retention plans and enable you to create some action plans focusing on some of the gaps that you feel are most important in getting into place so that your member organizations are ready to employ these allied health professional students that you're working so hard to recruit and train and get out into your communities. And then finally, the 4th piece of the toolkit is a samples document, and that's merely a booklet of various types of samples of different pieces of a recruitment and retention plan. And we'll touch on the samples document later, but it's samples of work plans and budgets and so forth. And so that was one of the documents that I emailed to you, as well as all of those documents are in the file share in the bottom left-hand side of your screen. So I wanted to share with you and get you familiar with the words guide and assessment tool and action plan and so forth, because now we're going to touch on the instructions for the deliverable. And so there's kind of 3 steps in the instructions for this deliverable, and then later when we're finished with this, we'll kind of delve into the toolkit itself. But so network directors or project directors, your role to start with is going to be distributing the recruitment and retention plan guide and assessment, and you'll see what those look like in just a bit. And you're going to get those to all of your healthcare member organizations. The healthcare member organizations are going to complete the assessments, and you're going to collect them all back, and then using the network recruitment and retention summary and action plan template, you're going to summarize all of the results from the completed assessments, and then you're going to identify gaps, and then that's where you're going to create your action plan. Now, for the member healthcare organizations that are on the line, this is where your role comes in. So as we said in the previous slide, the network director or project director is going to get to you the recruitment and retention plan assessment along with a copy of the guide for reference. And you're really going to just, referring to your organization's current healthcare professional recruitment and retention plan, complete the assessment. And you're just gonna, it's kind of like a checklist. You know, are you currently doing this? Are you doing that? And just kind of cross-referencing with your own recruitment and retention plan, checking off on the assessment, the activities that you're currently doing, and stuff that you're maybe not doing or you're in the process of implementing. And we'll look at that later too. But your job is going to be to complete the assessment and get that back to your network director or project director. And the final step is, again, then for you network directors and project directors to collect those assessments. And then the deliverable document, the deliverable documents include the assessment summary and the recruitment and retention action plan. And so, like I said earlier, you're going to summarize all of the assessments returned, identify gaps and barriers and challenges, and create your action plans for those areas, and then just simply following the directions provided within the EHB to submit your deliverable. And I'm not for sure, but it might in the EHB refer to this deliverable as the employment hiring plan. I'm happy to take questions on that as you all go along within this process. Email me, call me, refer to the PowerPoint. There's directions in the toolkit as well. So the recruitment and retention guide. That's just a screenshot here of what the guide looks like for those of you who haven't opened the document yet or downloaded it. And planning and preparation is really the most important ingredient for ensuring a successful recruitment effort. And it's the first part of a recruitment plan. A recruitment plan is broken into kind of 2 halves. You've got the recruitment or the planning and preparation, and then followed by the retention and which is basically the follow-up and the follow-through. And planning and preparation is really important in ensuring your successful effort. But it's also a part that's most often neglected. Many communities jump into the recruitment process with very little preparation, and in turn spend more time and money on recruitment and experience less retention success. And so the first parts of the guide are going to be about the workforce needs assessment, building your recruitment and retention team, kind of defining and creating your practice opportunity profile, and then also creating and kind of mapping out your recruitment and retention marketing plan. And so let's touch on each one of those individually. And so the workforce needs assessment. I'm not sure why that's delayed like that, but so understanding workforce needs. A needs assessment really just provides necessary, quantifiable information on your existing workforce or lack thereof in the geographical area that you're serving. Findings from a needs assessment also help your network in knowing how to meaningfully assist your member healthcare organizations in filling any gaps that they may have in their recruitment and retention plans to ensure your readiness as a network to after these students are trained, to get them out into the workforce and then hopefully keep them in the areas that you're recruiting them to. I think most of you have done your needs assessment, but it's an important piece before you begin any recruitment project. Let's see, the next step, and for those of you who are following along in the guide, I'm on page 6 of the guide, and we're going to talk about building your recruitment and retention team. And so a team approach is just a really effective way to engage all the tasks that come along with the recruitment and retention process. It really is helpful for cutting down the work so that not just one member or one or two people are doing it. There's a lot of steps involved in a successful recruitment and retention process. And so if you recruit a team, it becomes a team effort and it becomes a lot more manageable. I would say that most successful recruitment and retention efforts benefit from some level of community involvement. And by partnering with your community in this process, it also demonstrates that the community cares enough about the local healthcare to actually be a part of its success. And so I've listed on the screen, not only do we want the network directors and project directors involved in this recruitment and retention team, but some ideas of people from the healthcare facilities that could play a part on this recruitment and retention team would be clinic or hospital administrators, a representative from the Human Resources Department, maybe an allied health staff representative. So if you're happen to be recruiting physical therapy assistants, then maybe you would have someone from that department on your recruitment and retention team, maybe a DON. It looks like I got HR staff on there twice. Community representatives, so maybe someone from local economic development, someone from the education system, Chamber of Commerce, just a local community member who would be willing to work closely with the spouse and family of the healthcare provider being hired. Maybe someone from a bank or a financial institution and a realtor. And so don't limit yourself to the list on the slide. It's just really a guideline to get you thinking about the types of members that you can add to this team within the healthcare facilities and the communities. Next is the practice opportunity profile. And that might be a sentence or a phrase that some of you or even a lot of you aren't really familiar with, but really what it is a write-up of the practice opportunity or the job opening that you have. And so in writing a quality practice opportunity profile, it's really going to help you to understand the strengths and weaknesses of your opportunity. It's going to help you better identify the candidates who are right for your opportunity, as well as help the candidates better understand whether or not your opportunity and the community is right for them and their family. And so in a fully defined practice opportunity profile, you want to cover 3 areas, and one is the practice description, the second is the candidate qualification, and the third one is the community description. And so some of the things that would fall under that umbrella of practice description are things like, what is the scope of the practice? What's the practice setting? Is it a single specialty group? Is it a multi-specialty group? Is it part of a health system? Is it a hospital? And what are the services that facility provides? What's the makeup of the staff? What's the average number of patients per day that particular allied health professional might be seeing? What is their work schedule going to be? Are they going to have a call schedule, and what might that be? Is your salary and going to be competitive? The name of the admitting hospital and some of its services. So those are some things that can fall under that umbrella of the description. Candidate qualifications would be things like the educational background. So what do you need in regards to a degree or licensure or certification? Do you prefer any type of experience? What technical knowledge or skills are going to be required? And then also what personal and professional qualities and characteristics are you looking for in your candidates? And then community description, I think a lot of you are probably recruiting from within your own community. But for future too, if you've got someone coming in from another community, it's really nice to include in your description some information about the community, like just location demographics, the economy, what are some of the local organizations in the community, who are the major employers, include a little bit about the education system that you have there. It's a really great place to boast about your recreational activities and amenities that your city has or your geographical region. And so including all of those things into a practice opportunity profile is really going to give it's really going to help when it comes to marketing and promoting your openings. The next step would be to think about your recruitment and retention marketing plan. And to strategically promote your organization and your community, you really should have a marketing plan. And the purpose of a plan is to help you clearly define what you'd like to achieve, determine which audiences that you want to communicate with, developing strategies and plans of action, and then within your budget, you want to keep in mind you want to keep that all within your budget. And then hopefully the ultimate result is achieving your recruitment and retention goals. And some important things to keep in mind while you're recruiting and you're in this recruitment process is that recruitment activity expenses can add up really quickly, as well as filling these opening positions that you have in a timely manner can be really important as well, because you want to bring as little disruption to the continuity of care in your communities as possible. So we want to get these practice opportunity promotions out into the public via a whole bunch of different venues and get our interviews done and get the best quality candidates hired in a really timely fashion. And then also just keep in mind, too, remembering that there's going to be an increase in the amount of work for the people who are involved in this recruitment and retention process. You know, there's a lot of extra time and effort that goes into finding, interviewing, integrating, and retaining these candidates. And so you'll want to allow for extra time outside of your daily work activities. So those are the four pieces. Oh, I'm sorry. You know what? I'm going to go back. I didn't touch on them specifically. But the recruitment and retention marketing plan consists of four key components. So it's creating your recruitment budget, defining your target audiences, and then creating your work plan with a timeline, and then the promotion aspect. And we do have further explanation on each one of those in the guide, as well as a sample of a recruitment budget, a work plan with a timeline, and various places and venues to promote or market your practice opportunities. And so you can use those for a reference as well. So this slide loaded goofy for me, so I'm going to bring them all up. So the second half of the second phase of a recruitment and retention plan is the retention phase, or the follow-up and the follow-through. And so during this phase of the recruitment and retention process, our thinking needs to shift from hiring the right person to now considering how are we going to retain him or her into the healthcare organization long term. And this shift to retention thinking begins as soon as a candidate accepts an employment offer. And it really continues throughout the length or the duration of their employment with your facility. And some of the key components of a successful retention plan is doing little things like maintaining regular contact with that new healthcare professional and their families, really just to stay informed and aware of how are they acclimating to their new work environment and to their community. You know, is the spouse and family members getting what they need out of the community, and you know, did the spouse or significant other of the healthcare professional that you hired, were they able to find employment in the community? And are they pleased with the school system? Are they looking for maybe one of their kids is a swimmer, and so someone in the community is going to help them find a pool or a swim team or maybe, you know, something like that. So you want to make sure to stay in really close contact with the family as well. One of the biggest reasons for non-retention of healthcare providers is that their spouse or significant others in their families are not happy in the community. And if they're not happy in the community, they're going to get your new employee to leave. And so when you think about recruiting, you don't want to just stop at the healthcare professional that you hired, but pay a lot of attention to the significant other and family. Let's see. It's also a really good time to maybe mitigate any potential problems that could impact their desire to stay in the community. And so this part, or this second phase of the retention plan, includes pre-orientation activities. It includes orientation activities that happen the first week of employment. It's your onboarding activities that take place over the course of the first year of employment. And then also just an evaluation of your recruitment and retention plan from cover to cover. And so that's something that you want to do ongoing and for sure annually to make sure that there aren't any places that could use some adjustments in your plan. So here is an example of a pre-orientation schedule. Pre-orientation activities take place before the new hire begins employment. And so this is kind of a snapshot out of the sample document that we've provided. And it's a work plan and some action steps of things that you want to, an example of some things that you may want to do before the new employee has their first day of work. So such things as sending a welcome letter that includes the date, time, and location of the orientation. If the new employee needs to have a photo taken, you would get that scheduled prior to them coming their first day. You would initiate notification of the new hire internally via maybe the website announcements, putting it in a newsletter, ensuring that HR knows, letting the department of that provider type know that there's a new employee starting. This is when you would choose mentors for the healthcare provider as well as the spouse and family. And a mentor for the allied health professional is going to be someone from their department who's going to be kind of put together with them. And the new healthcare provider is going to know that this particular person in my department is my go-to person for as long as I need that person. And it's going to be maybe you would schedule weekly lunches with the mentor and the new healthcare provider, or the community mentor and the family. Might be a monthly get-together lunch or something like that. The community member would ensure that the family's getting what they need in regard to employment in the community, and that they're finding what they need and meeting people and getting involved in community organizations and events, and that they're happy. And then the healthcare professional mentor is going to be that one person where the new employee can go to them for silly things like, where's the best place to go to lunch? Or, hey, I'm really having a problem with this part of my, within the scope of my practice, and who do I go to talk about this? And so it's going to be that one go-to person that's going to be available for this allied health professional for as long as he or she needs one. You're also going to want to schedule any clinic or hospital tours, ensure ID badges, uniforms, parking instructions, building keys, and all that kind of stuff are ready to go and distribute on that first day when the provider starts. And when I say provider, I'm referring to allied health professionals. They're kind of a provider of health care on different levels. So that's stuff that takes place prior, as an example of some things that take place prior to a new hire. So now the first week that the new hire comes in, here's another screenshot or a snapshot of some activities that may take place during that week. And it's things like just providing the general organization or general orientation of the hiring organization, kind of refreshing and going over what that specific allied health professional's job responsibilities are going to be, explaining any departmental relationships, teaching them how to use necessary medical equipment, going over the electronic health record software with them, letting them know if they or the clinic are affiliated with any other programs, are there any referral systems in place, what's the organizational mission and vision. They'll probably have a meeting with human resources to cover maybe an employee handbook and do the tax forms, benefit package, payroll procedures, that sort of thing. This is then when you would provide them with their ID badges and uniforms and parking instructions and keys if that's applicable. And then the mentor introductions would take place here as well, as well as maybe providing that weekly lunch meeting schedule if that's something that your organization decides to do. Onboarding, the first year. So onboarding activities typically take place over the course of the first year, and I'm going to go through this quickly because we've got quite a bit to go, and I feel like I'm using up way too much time here, but really just gathering feedback on the orientation onboarding process. The mentor remains in contact. You hold quarterly meetings to get feedback on the new hire job satisfaction. This is where you would kind of implement your employee performance agreements and hold your annual performance review with that employee and job satisfaction surveys and so forth. And then finally, the last piece would be the recruitment and retention evaluation plan. And I'm on page 13 of the guide now. And this is really where you're selecting key processes and outcomes data and identifying specific and defined measurements that are critical to evaluation. And so you also want to consider, too, when this data is going to be collected and then who is responsible for gathering it. And so monitoring and tracking your key measures can also be a really effective way of illustrating your recruitment and retention plan progress and its impact that you're having. And just a few examples of some of the key measures might include the number of new students enrolled into programs, the number of those students achieving licensure or certification, number of graduates that become employed with your member network, healthcare organizations, satisfaction scores, retention of new hires in the community. So that's a quick look at the recruitment and retention plan. And now I want to just touch base a little bit on the next document in the toolkit, which is the Recruitment and Retention Plan Assessment. And so this is a snapshot of what the assessment looks like that the network project directors or project directors are going to make sure that their member healthcare organizations receive. This is the document, for those of you who are on the line that are from the healthcare organizations, this is the document that you're going to complete. And for example, one of the questions is that a recruitment and retention team has been assembled. And the scale is a 5 through a 1. And a 5 would be that you've fully completed or fully implemented a recruitment and retention team. A 4 might mean that it's in development or in progress. A 3 means you don't have one, but you're considering it. A 2 would be you haven't ever even considered one. And a 1 is that not only have you not considered one, you've decided you're not going to have one. And so that's kind of the scoring process throughout the assessment. And so it shouldn't take you very long to complete that. And then the hopes is to get that back to your network directors or project directors in a timely fashion so they can begin the summarizing process. So now here's where I'm going to turn over to Cap. She's going to talk about the recruitment and retention action plan template as well as the samples document, which are the last 2 pieces of the toolkit.
Great. Thank you, Angie, for that complete walkthrough of the guide and the introduction of the assessment document. I'm just going to highlight quickly that the assessment is laid out in a way that moves you through the guide. So you can use that guide as a reference as you're considering your answers and thinking about your own recruitment and retention plans. So then this brings us to the recruitment and retention summary and action plan template. This is the 3rd component of your recruitment and retention plan toolkit that we've put together for you. And it is actually this document that the project or network leader will complete and use as the deliverable. So this is the one document that gets uploaded to the EHB as your deliverable. And the purpose of this particular effort, the template, an action planning template, is to create an intentional opportunity for the project and network leaders to engage with your participating healthcare members in establishing the recruitment and retention planning efforts that will support the newly trained allied health workforce that's coming out of your training programs. There are 2 parts to the action plan. It's an assessment summary and an action plan template. I'll show you, move to the summary piece, and it looks exactly like the assessments that each of the healthcare organizations will be completing. So the project and network leaders will summarize the results of their healthcare organization members who complete the recruitment and retention assessment and place on the far right side of each question an average rating for each of the questions. It's a summary of their individual members' assessments. This will really act as a gap analysis or a tool to find those opportunities where the network or project leader can easily identify where the network can actually help their members improve on their recruitment and retention plans. And the instructions for this particular document is that after the summary is completed where the average rating is identified for each one of the questions, you'll be able to see those questions that have a lower rating, a lower score. Our suggestion is to look for those in the 2 range because they'll be in that area where the work isn't being done yet. There'll be lots of reasons for it, all of them perfectly legitimate, I'm sure, but the opportunity is that the network of project can address those and maybe help their members move forward in improving their retention and recruitment and retention plans. So I'm going to go to the next section of this action planning template. And what we've provided here is truly a template, an open grid that allows the network and project leaders to create an action plan for those items in their summary that have a lower score or those opportunities to make improvement for your healthcare organization partners and members. What we would like to see for the deliverable is that you complete 3 specific action plans based on selecting 3 opportunities out of your assessment summary. So 3 different items in the assessment that score lower and identify those gaps and opportunities for improvement will have an action plan created for them. The output of your deliverable then will be the summary, a document of the assessment, and 3 different action plans created using this template if it's helpful. Tips for doing the action plan include, 1, using this template so that it's a little bit easier for you to lay out and you don't have to recreate the wheel for that. At the very top section, describe or give a title to the improvement that's being identified based off of the recruitment and retention plan summary. And then think about the actions that you could provide as a network or a project to your member organizations for that particular opportunity for improvement. I would suggest thinking in kind of a 6 to 12 month range. Sometimes your action plans will be much shorter. You'll be able to get them done in a matter of even weeks or a few months. But I would suggest keeping it within a year, action plans that you can get done within a year. And as always when you're action planning, knowing who's going to be really leading the charge on the action, when you plan to get that particular action started and when it will be due are good ways to keep the ball rolling on your action planning. So that is the document. That is the document that we'll be using for your deliverable. I'm also going to just highlight that this particular action plan, the reason that we created it in an action planning environment is to give you all as network and project leaders an opportunity to have a dynamic input impact on your members' efforts towards recruitment and retention. So you can have an action plan that gets updated over the next 2 years of your effort in this particular project. Because of the importance of recruitment and retention in the success of this project, we really wanted to provide you all with an opportunity to be proactive and sort out how can you help your healthcare partners and members to continue to improve their efforts in recruitment and retention. And that leads us to the last section of our toolkit. We put a bunch of samples together. We're calling it the Recruitment and Retention Plan Samples document. And in that we have a list of different types of charts or checklists or samples, even examples of all the things that we've mentioned in the guide that we feel like if there is a need for support of your members in helping with their recruitment and retention efforts, you can share this as network and project leads with your healthcare organizations as they continue on their work towards effective recruitment and retention. Or perhaps there's some education that you can help provide to your members so that they can learn and improve their planning efforts around recruitment and retention. I'm going to move us to the question and answer section of this presentation because I'd like to create that opportunity for us to have some answer some questions and highlight a few things. Any folks that would like to ask that for clarification of any of the sections of the guide?
So this is Angie again. This is Angie again, and Cindy had asked, are we to do an action plan and summary for each individual member of the network? And so it would be no. All of your individual clinics, hospitals, the healthcare organizations that are your members would fill out the assessment, and then the summary would be just that, a summary of the responses of all of your healthcare facilities. And then you would, from your summary, you would look at the areas within the assessment that scored the lowest overall, and then you would choose 3 that you want to kind of tackle as trying to improve within the overall recruitment and retention plans of your members, if that makes sense. And I want to remind you all, too, that the template that Cap talked about, the summary and action plan, that's a live document. We gave that to you in a Word format, so please don't be afraid to use that actual document in submitting. I think it'll help you save some time in that regard. Are there any questions about the guide, the assessment, the summary and the action plan document, the network or project director roles, or the healthcare facility role? Does anyone
Angie,
want...
this is Cap.
Oh, go ahead.
Oh, well, Angie, you were just going to ask the same question I was going to ask the group. If anyone would be willing to share a little bit about what do they know their members are working on with recruitment and retention plan, or healthcare organizations that are on the call with us today, which we are so glad to have you with us. Anyone willing to share what they're working on in their recruitment and retention plan?
This is Angie. I remember from our grantee meeting that we talked a little bit about recruitment and retention plans and recruiting with retention in mind. And I know that some of you said you had already been working with your healthcare facilities on their recruitment and retention plan. So those of you who have done that, if you don't mind sharing with us maybe what steps you've taken or how you've been working with your healthcare facilities to this point. It might help others who haven't been in contact in that fashion yet. You can use the chat box or press *2 to unmute your phone line if you're willing to share. I hate to do this to you. I'm going to see if you're still on the line, Beth Ann. I feel like I remember you mentioning some work that you had done or some communication that you've had with your healthcare facilities in your network. Would you mind sharing any communication you've had or steps that you've had in working with them on their recruitment and retention plan? Looks like Beth Ann is typing. Yeah, and Aspen, if you want to unmute your line and share, that would be great.
Sure. Here we are.
Hi.
Hello. So what we've been doing is actually we have a third party come in to help us with this. We're with Purdue. And so what they've been doing is actually going to the centers that we're connected with, and they're actually already kind of developing surveys and trying to get more information from them about what has been working, what's changed, is there anything that they still need. And so we're actually in the middle of that, and we're about to get some results back from them in the next few weeks.
And this process is going to be for the life of the grant. So it's a 3-year process. Each one we'll review changes. Every year they help to develop individualized plans for our centers that reference recruitment and retention with a heavy emphasis on the retention part. And then what we'll do is after they'll develop individualized plans for the centers, as part of our grant, and then we'll survey, the same survey questions every year, and hopefully at the end of the 3-year period, we'll have some real figures on what works, what doesn't work. It was quite an extensive survey. It was sent out to how many? It was all 3 of our partners, behavioral health centers.
8 locations.
8 locations. All of the bachelor's level people filled out that survey, and then also, and so they took that information back based on that granular of a survey response.
That's great, you guys. This is Cap, and I think that's a lot of the kind of the thinking that we put into this particular toolkit is helping you all as the project leads help your healthcare organizations be thinking about that recruitment with retention in mind. So it's ours probably isn't as thorough as the work that you've elicited your organization to follow through with on your individual members, but it's a very similar approach that we're hoping that it kind of spurs some conversation and adjusting of those recruitment and retention plans.
Yeah, one of the things that we found out, there was a couple of surprising results that we found out that some of the things that the centers valued and thought were good recruiting tools weren't as valued as they had suspected. I mean, all of them actually were valued. And the nice thing that we found out, and this is one of the retention things, is that for the most part, for ours, it's behavioral health technicians, which is bachelor's level position. Most of them liked their job, and what they didn't like was some of the things we suspected and some things we didn't suspect. So having that kind of information was eye-opening for our facilities. Even after the first year, we're kind of excited to see what we get when they ask this year. Yeah, which they're doing the surveying right now as we speak.
Oh, neat. That's good. Yeah, and one of our suggestions had been that both annual kind of a performance agreement kind of a thing, but also an annual staff satisfaction check-in. So the idea that you keep tuned in to your staff and how they're doing and what they like and what they would like different about their work so that you can understand what they value as employers.
Exactly.
Yeah. Terrific. Angie has brought us to our last page, so we certainly appreciate your input. But as we're here, we do have a few more minutes. If anyone else would share what they're working on or thinking about. I'm going to interject one more thing, too, while you're getting ready to unmute your phones. Several of you are probably about to do that. If this particular action plan template it seems a little incongruent with how you are interacting with your healthcare organizations, please give us a call, either Angie or I, and we can modify the template. It's not written in stone. It's just a way we imagined you being able to gather input from your healthcare partners so that you can understand how they're approaching their recruitment and retention planning, and then as a network and project, how you can figure out how to help them as they move forward in developing those robust plans. Anyone wanting to unmute, star 2 to unmute and share what you're working on regarding recruitment and retention planning?
Hey, Cap, this is Cindy.
Yes, hi, Cindy. Go right ahead. Oh, Cindy, we lost you. Try again, maybe. Star 2 to unmute. Well, if we have a a suggestion from Cindy. If we get her voice back either in the next sec or if she can send us an email, we will pass on any thoughts if she has something to share with the large group. Angie, I'm going to pass it back to you for any wrap-up.
All right, thank you. Yeah, so if no one else has, it looks like Cindy's typing, so we'll hang tight here and see what she's, oh, she lost her phone, went dead. Shoot. Well, Cindy, you can, I'll send her a message. She probably can't hear me if her phone went dead. But well, like Cap said, we'll pass that along. But if no one else has anything else that they want to share in regards to what they're doing with their member organizations, I want to thank you all for participating. I think we had a really nice turnout for this call. I want to thank all of the healthcare facilities that joined our call. We're so glad that you could make it, and we hope that this was a helpful presentation for you in regard to your role in this deliverable, and also for the recruitment and retention of these providers into your community. A reminder to please complete the evaluation on the screen, as well as on the top right-hand corner there is a question where we would like your feedback for suggested topic areas for webinars and peer group calls for this second program year. So we welcome those always. Some upcoming events would be November 9th is our next webinar, and this is subject to change, but right now we're planning on the topic being a conversation around intergenerational workforce, and so it would be like inner office or inner workplace types of communication and working together, multiple generations working together, as well as marketing and recruiting different generations into the workforce, and what types of venues and techniques work best with individual generations. And so you can put that on your calendar, and we will get out a save the date very shortly for that. And then also the beginning of September would be our next round of TA check-in calls. And to my knowledge, these are going to be just general check-in calls. The last calls we had, we were reviewing strategic plans, but this one is going to just be some general technical assistance guidance and us getting to talk with you more about the work that you're doing. And yeah, oh yeah.
This is Marsha. I just wanted to interject to first say that I'm on the call, and I want to thank everyone for tuning in and for your participation, even with the evaluation of this webinar. But as I'm listening to how you all finally came up with the toolkit in terms of you all working on it for a while now, it's amazing to me, and I thank you for that. And I just want to also say that remembering that the purpose of this this grant or this program was really focused on retention and recruitment and retention. So this document will be very important not only for the submission in the EHB in early December, but for an ongoing effort in terms of allied health professionals in rural areas. So I look forward to seeing this particular document and how these funds have helped you to grow in terms of the existence of allied health professionals in your areas. And let me also say that I did send a PIMS update for you all. It still has not been approved by OMB, but that template that I had sent, or the draft that I sent some time ago, is still roughly what we expect to see on the finalized PIMS. And I don't know when that's going to be released. Thank you.
Thank you, Marsha. I appreciate that. So we are 3 minutes over, so I appreciate those of you who are still on the call for sticking around, and please let Cap or I know if you have any questions along the way during this deliverable. Like Cap said, we can tweak samples and templates for you to best fit kind of the direction and work plans that you already have going, help you troubleshoot and that
Perry
type
County
of thing.
Memorial Hospital is conveniently located in the center of
So please reach out.
facilities.
whenever you need to. And with that, I think we'll go ahead and close the call. So thank you all for your participation today.
Procedure testing. Ask your provider for a referral to Perry County Memorial Hospital.
Perry County Memorial Hospital. This conference is no longer being recorded.